When families come to us, they are usually in crisis and they feel overwhelmed, and all of their hopes for their child's future are just feeling in complete jeopardy. From our very first contact, we want them to know that they are not a number or statistic. They have an important story to tell, and we'll do everything we can to understand the trauma they have experienced and identify treatments that will make a difference. So as soon as possible, we bring the family in for a comprehensive assessment. We're not simply documenting what has happened to the child. We're identifying and measuring the trauma symptoms the child is experiencing. Assessment and measuring symptoms sound so clinical when you're talking about a child who's been traumatized, but this is what allows us to see what is beneath the sadness, the anger, the self-destructive behaviors, and understand exactly how a child's normal development and health are being impaired. And it gives us the measurable benchmarks that will tell us that a child is truly experiencing healing. After the assessment, we create a treatment plan tailored to the child's age and symptoms, as well as any complicating factors like family history or custody circumstances. Treatment really is different for every family, but there are 3 primary models that we use. Trauma-focused cognitive behavioral therapy is for school-age kids and teens with trauma symptoms, and it looks like what most folks picture when they think of therapy: a therapist and a child sitting in comfy chairs talking. But there's much more to it than that. We are coaching a child through a specific set of insights and skills. We get them emotionally ready to talk about these really hard things. This includes increasing their emotional vocabulary, teaching them coping mechanisms, and helping their parent be ready to support them. Next, we go more intensively into the details of their trauma to identify ways of thinking that are blocking their ability to heal. Finally, we return to the story of their trauma in a way that the child sees he is more and more capable of thinking about it without being overwhelmed. The result is that what happened to them is now simply a memory, not a constant presence that undermines their ability to live a normal, healthy life. Child-parent psychotherapy is for kids 5 or younger, even as young as a few months old. A child that young can't really process trauma by describing thoughts and feelings or talking about what happened. They do it through the way they interact and behave in their primary relationships. And so what is really most healing for them is a close, trusting relationship with a parent or caregiver. Child-parent psychotherapy uses play along with developmental guidance and emotional support to build that relationship. Play also allows a child to communicate really difficult things that they just don't have words for. By strengthening a child's most essential relationship, we are activating their natural resilience, which reduces long-term impact of trauma. Parent-child interaction therapy is for young children with extreme levels of opposition or aggression, which can be the result of abuse or neglect. PCIT uses play, but rather than a way to communicate, play in PCIT is the context where we reshape the negative patterns that have developed between a parent and a child. PCIT is truly a unique treatment model where the therapist observes from behind a two-way mirror, coaching the parent through an earpiece. Research has shown that this approach is highly effective in teaching parents to build really positive, affirming bonds with their child and to use effective discipline that helps the child feel safe. And when parents have those skills, we see huge improvements in behavioral issues, not just in the child, but in parents too. Treatment sessions are usually 50 minutes once a week, but our therapists also spend a lot of time on a child's treatment outside of those sessions. Our team is highly collaborative and they consult with each other on cases in weekly meetings. And they work with the child's support system, like teachers or caseworkers or a guardian ad litem, to make sure other adults are reinforcing what is happening in treatment too. It's easy to describe what we do here in the clinic, but it's difficult to convey just how hard treatment can be for families. They have been through terrible experiences that are hard to talk about. Symptoms can be really complex, and treatment can take a long time. But when families persist, real healing happens. We can measure that healing in a post-treatment assessment, and we do. But where we really see it is in the confidence that children have when they complete treatment. They know they are okay, that they are strong, and that their parents are strong. and that together they are greater than the trauma they experienced.